Okay, fantastic. Please introduce yourself and your department.
I'm Aws Almufleh. I'm a cardiologist specializing in heart failure and echocardiography. Let me give you a bit of a background about heart failure in the community. From Ontario Health Statistics, we estimate that heart failure affects 1 in 33 people in Ontario. That's about 14,000 people in our catchment area alone, which is served by less than 30 cardiologists. So if you want any hope of managing those patients well and managing all of them, we must empower primary care to take ownership of heart failure diagnosis, management, and optimization. So we conceptualized this project. We started in primary care and with primary care providers, and we tried to understand in focus groups what are the barriers to manage patients with heart failure. We learned a lot. Primary care provider had difficulties accessing the diagnostics, knowing the correct interpretation of these tests, and having access to specialists' advice when they run into issues managing patients. The project supports the heart function clinic to become the backup for community providers. We summarized the complicated heart failure guidelines into a 2-page document that included diagnosis and management of heart failure. We made a patient conversation guide that guided primary care providers on how to discuss heart failure with patients. We also collaborated with other community partners like home and community care and community paramedics, where we try to get the care to patients where they need it and not wait until they show up at the hospital or the clinic. And this has been built on a foundation from Queen's and SEAMO Innovation portfolio that supported pathways here at KHSC. And we were fortunate to receive support from the Ministry for an integrated heart failure pathway, expanding the scope of this project. In all the interview, I've been talking about heart failure, and I'm very passionate about heart failure. That's what I do. But the reality is, as our population grow older, our patients are accumulating a lot of comorbidities, many more than just heart failure. And the model that we built and are building with our community partners, I think can be used for other conditions too, and that will lead to a healthier society with well-managed comorbidities, and that will impact the healthcare system. The scope of grants SEAMO supports is quite unique in my opinion. They encourage innovative grants, but particularly appreciate those with a local lens, meant to serve the local community, but also come up with lessons learned that can be applied everywhere. I think this sets SEAMO apart from other big grant agencies who may not have as much QI emphasis. I don't want this to sound like an acceptance award ceremony, but I really would be remiss if I failed to acknowledge the incredible team at the Heart Function Clinic, our primary care providers, home and community care, the community paramedics, and the leadership at Frontenac Clinic's Addington OHT, Dr. Kim Morrison. Two individuals who helped us and conveyed the patient voice, Sharon Vicker and Carrie Stewart. Carrie even has been generous with her time and sharing her experience, and she has participated with me on several other projects.